Okay, so we are in part 2 of our episode this evening, and it is the truth in elderly care. I was once working in an assisted living facility as a caregiver, and I really do enjoy this field of work. It can be such a pleasant field, and I love the elderly. I myself was a granny's girl, so I enjoyed being under her and watching her, and after her passing, I decided to continue caring for our elderly. But this field has changed so much. It's, no longer as pleasant, as it used to be because, the jobs, it used to be a beautiful place to work. And, now in some of these places, it's becoming to be a nightmare. And, not only for the elderly, but for those, who care for them, innocently, now it seems that, a lot of the elderly, I could say when I began, in the state that I live in now, a lot was, dying, back to back to back, and it seemed like a game of death. Like it just seemed like a game of death. And, I say that because when I was a caregiver, I saw a lot of things and I couldn't understand, but, I don't ever, want to, I would say I saw some things, but I would never want to, abandon, an elderly person that I cared for or leave them in a soiled, brief or anything like that. But, when I started this field of work, I was trained properly, and it was about the elderly, being properly cared for. I could go to work, and I loved being at work. I almost didn't want to leave, and I didn't mind, picking up extra shifts just so that I could be with my resident. But I will say that I have been noticing, and I keep up with this kind of stuff. I've been noticing that in this field, we don't quite, we're caregivers, and we care for our elderly, but we're not quite in their shoes. So I just wanted to kind of, have an episode and dedicate this episode to those that I care for, as well as the elderly. Now, so let me just begin with, so I wanted to touch on, I was reading up on, a research on that Kelly Short came up with, and, so I wanted to go over some elder abuse statistics for 2024, and last year, more than 7,600 health citations were issued to U.S. nursing homes due to abuse and neglect of residents. So, and both at home and in nursing facilities, many older adults experience abuse from their caregivers when they are at their most vulnerable. So, the National Center on Elder Abuse defines elder abuse as any intentional or negligent act by a caregiver or a trusted person that causes or creates a serious risk of harm to an older adult. It takes there's 5 primary forms. There's physical, psychological, sexual, financial, and neglect. So I want to go over some key elder abuse statistics. And like I said, I wanted to do this episode because, we don't bring this, we don't talk about this. You hear it on the news very, 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 you may hear it, every once in a while, but not as often. But I wanted to do an episode because it does happen. It really does happen. And I wanted to do an episode on this because I'm so passionate about it, but I want to discuss, let's look at the key elder abuse statistics. So around 10% of Americans 60 and older living at home will experience abuse, neglect, or exploitation in nursing homes or other care communities, though nearly 16% of residents report being abused. In 2023, U.S. nursing homes received 94,499 health citations, according to the Centers for Medicare and Medicaid Services. That's a lot. 8.1% of the citations, 7,654, had to do with the abuse, neglect, or exploitation of nursing home residents. And in 2023, U.S. nursing homes were fined $153 million for health violations of all kinds. So wow, so that's about 10,000 per facility. And in nursing homes and other care facilities, physical abuse was the most common form of abuse, followed by neglect and psychological abuse. Older people with dementia are especially vulnerable, as many as 1 in 2 people with dementia experience abuse. That is something. So about 17% of the U.S. population is 65 and older, and as many as 70% of seniors may need long-term services or care at some point in their lives. So nursing homes pose as a higher than usual risk of abuse versus assisted living facilities. For instance, like nursing home residents may have more complex physical or neurological health conditions, making them less able to protect themselves compared with those in assisted living or living at home. So I would think, wow, nursing homes, yeah, they have a lot of residents, but that's pretty high. That's pretty devastating. So according to the Centers for Medicare and Medicaid Services, discovered more than a few troubling issues with abuse in the U.S. nursing homes. In 2023, U.S. nursing homes, like I said, received 94,499 health citations. And of those citations, 7,654 of those citations were issued due to neglect, abuse, and exploitation of residents. Wow. So the most common type of violation, dealt with quality of life, care, deficiencies. So let's look at, the deficiency category. I want to discuss that. The quality of life and care deficiencies, that was the percentage of citations for that was 27%. And residents' rights deficiencies percentage was 15%. Resident assessment and care planning deficiencies was 14%. Wow. And freedom from abuse, neglect, and exploitation deficiencies was 8%. So we have environmental deficiencies, that was 3%. So in 2023, nearly 30% of abuse citations related to the facility not promptly reporting abuse, neglect, or theft. Around 11% of abuse citations had to do with a lack of policies that would prevent abuse of elderly residents, and 5% had to do with the wrongful use of nursing home residents' money. Wow. So the nature of abuse citations issued. Abuse deficiency was timely report suspected abuse, neglect, or theft and report the results of the investigation to proper authorities. That's, the percentage of that was 30%. And to, protect each resident from all types of abuse, such as physical, mental, sexual abuse, physical punishment, and neglect by anybody, that's 29%. 29% of citations, and respond appropriately to all alleged violations, that was 19%. Develop and implement policies and procedures to prevent abuse, neglect, and theft, that was 11%. So This is alarming. About 1.4 million plus residents live in U.S. nursing homes certified by Medicare and Medicaid. 63% of nursing home residents are women, and nearly half of those women have Alzheimer's or other forms of dementia. More than 1.2 million people work in these nursing homes. And in 2023, this is alarming as well. U.S. nursing homes were fined $153 million for health violations. This equated to $10,000 per facility. And the following states had the most citations on average in 2023. You had New Mexico. Their citations was 13.3%. Illinois, 11.7%, Nevada, 10.8%, Washington, 10.7%, and Hawaii, 10.5%. That is alarming. So, let's go over the types of elder abuse. So it can take on many forms, especially in nursing home settings. But the type of abuse is physical abuse. The percentage of complaints for that was 38%. Gross neglect was 24%. Psychological abuse was 16%. Financial exploitation was 14%. Sexual abuse, you can't even imagine, sexual abuse was 8%. Psychological abuse, which includes emotional and verbal abuse, was also common, making up 16% of the complaints in 2022. So let's go over physical abuse. Physical abuse, older adults who experience elder mistreatment are about 3 times more likely to need emergency department care and about twice as likely to need hospitalization due to physical abuse. A study in the International Journey of Care showed that elderly physical abuse victims commonly get assaulted with an abuser's body part rather than an object. When abusers use objects, they are more likely to be household items, versus weapons. So, and that, knowing this may help medical providers and others identify elder abuse more easily. So it's easy for someone to victimize a resident with an object versus a weapon. They can pick up something, but physical abuse, 4.1%, and 20% of cases, victims had blunt assault with a hand or fist, and the most common injury was bruising caused by assault with the hand or fist. And then you have financial exploitation and financial abuse. Seniors in both and out of nursing homes can be victims of financial abuse, and that is using a credit card, taking their money. It occurs like a caregiver, can illegally or improperly use a, senior's money, for their personal use or their personal benefit. So that is 5.2% of seniors experience financial fraud or exploitation. And let's see, offenders steal about $28.3 billion yearly from seniors 60 and over.